Today we are going to talk about alopecia areata. Alopecia areata is not a very common condition. It happens to less than 10% of the people. Alopecia areata means patchy hair loss. It can be any part of the scalp. If it happens, say more towards the underside of the hair, you can cover it. And if it's happened at the back also, you don't really see it. The worst place it can happen is on the top crown over here or over here. Alopecia areata can be quite scary because it happens almost overnight, and it's quite a large patch and it can be quite shocking. So this is a female condition, and it happens right here at the back, around here. And usually this kind of condition, you will need somebody else to tell you. For example, you go to your hairdresser for a haircut, or you go for a wash and blow, and then suddenly the person will be like, oh no, I think you have a hair loss problem. Or sometimes maybe when you accidentally touch your scalp when you are washing hair or just fiddling with your hair, then you suddenly realize that there is a very strange feeling on your skin. Alopecia areata can also happen to men as well, and you can see there are multiple areas of budding. It's what we call a autoimmune disorder. The immune system is not functioning properly. It starts to mistake your hair follicle or your hair as a foreign object, something that is invading your body. So the autoimmune system starts to attack the hair follicles. So your white blood cell is attacking your hair follicle, weaken the hair. When it is so weak, it will break. So when it is broken inside the skin, then suddenly overnight you see lots of hair on your pillow, and then you see one whole patch of the skin without hair. If it happens to be broken just on the skin surface, you can actually see black dots like ants onto the skin. Most of the time, usually you would see conditions like this, really whole area bald, no hair at all. Sometimes all these patch, small one, can actually become larger because the surrounding hair follicle can also be attacked by the same immune system that is not working properly. So when there are more area being affected, then it can become so bad that the total area being bald at the same time. And that kind is what we call alopecia totalis. Sometimes if it's really bad, it can also affect the eyebrow, the eyelash. For some men, it can also affect them on the beard area as well. Some Chinese people call this condition 鬼剃头 because it really happens so suddenly, and some people just feel quite mysterious about it. So why do we have conditions like that? This can actually be hereditary condition. They can also be due to some medical condition. I have seen many clients who has got alopecia areata and they have some medical conditions like lupus. This condition is also related to external or extreme emotional trauma. There's this other client, she actually fell and she knocked her head onto a hard surface. After recovering, then she realized that she has this bald patch on her scalp. Somehow or other, the immune system is reacting to it. Conditions like this can actually be treated, and our approach is to use natural source. We use infrared heat to promote circulation. We use UV to shine onto the area for maybe a good 10-15 minutes to create very mild irritation on the scalp and allows the body immune system to repair the mild irritation. In that way, we are diverting the immune system to work properly and then leaving the hair follicle alone, and in the process hoping that the immune system will then recognize the hair follicle now that this is your own cells and you don't attack it anymore. Then the recurrence of this alopecia areata will not happen so frequently. So remember, once you found something like this, or you saw your friend complaining, or somebody talking to you about things like that, it's important to seek treatment quickly. During the treatment, we have observed the patch itself. If it's starting to recover, you start to see that it will not spread anymore, and then the growth is interesting. It will start right in the middle of the patch, and when the hair regrows, it can regrow in the opposite color. So for example, if your natural color is quite dark like brown color or black color, the hair can start to grow up white color, and it can actually be very fine and very small like baby hair. Once this thing happen, maybe for a week or two, the pigment start to take place, and then the hair will start to grow with a normal hair, with a normal hair color. It's a very interesting phenomenon which we can't explain, but this is what happened. Some of my clients that come to seek help for patchy hair loss due to lupus, diabetic conditions, or hereditary diabetic conditions, or medications that causes all these conditions. So what we usually recommend is to visit us quite regularly after completing the treatment, and right after the hair fully recover, they can come back maybe once every 2-3 months. We can always help them look out to see whether there is any cause or concern. If we're seeing there's some recurrence, we can address the condition again and try to help them grow the hair and making sure that the scalp is healthy and that the hair is growing properly.